The next sort of clinical question that we want to answer is, well, how is this person's nerve functioning? Which is a question we're answering, of course, whenever we do a neurological exam. Again, I'm not going to sort of take you over things you already know, but just what I would recommend with the neurological exam in order to get better at it. Or to do it what I call almost mindfully. So often it becomes a bit of a routine, but it's a good idea to kind of take a bit of time to work out what you're doing and why. And describe it to the patient as well, because that helps to kind of almost test your knowledge. So you can say, I want to check the health of your nerve, and one of the jobs that your nerve does is it touch your leg. It conducts a sensation up to your brain so that you know I'm touching your leg, and that's what I'm doing here. That's what I'm testing. The thing we're testing with most, the most common sort of type of neuro exam is large fibers. So those are kind of A alpha and A beta fibers. And so that's what we're testing with sort of cotton bud reflexes and sort of muscle strength testing. They only make up 30% of the nerve or so. The other 70% is small fibers. So C fibers and A delta fibers that conduct sensations that the brain processes as pain, so conducts nociception, and heat and cold as well. They have a job there. So that opens a question, well, should we be testing those fibers? And if you were to do that, you can do it with, say, a coin that's left on a radiator so that it's hot, or a coin that's cold, or that kind of thing. The most sort of convenient thing that I've worked out to do it is just to order off Amazon, or if you work somewhere that has them, use the pinprick, these little pinprick testing things, which are pretty cheap. And then that way you can say that you've tested the whole of the nerve.